while there is in this country a great divide about what the solution is, I think there is consensus on a couple of ideas. I think there's consensus on the fact that we can't pour more money into the same system we have and get different results. And that pouring more money into the system at this point is almost untenable if we don't change the system, because not only are we not getting the outcomes that we need, we can't afford it, and we can't afford it as a country. I think the second area where I think there's growing consensus on is that we need to move away from a system that has been so reactive and disease-oriented and episodic to one that focuses much more on health prevention, promotion, providing more seamless kinds of care. So I'm very interested in new models, and that's partly why I was really curious to learn more about AgeWell. And when I think about what are the characteristics going to be of new models, and new models that are both viable, appeal to people, and are sustainable, I think they'll have the following kinds of characteristics. I think, first of all, they'll be very human-centered and person-centered, and they'll care for the whole person, the body, mind, and spirit. Really compelling evidence that people are tired of a system approach where their heart is taken care of or their brain is taken care of, but not a whole person approach. I think more and more we'll see work that includes not only the client or the patient, but those that surround the patient, the family. A piece of research, NIH-funded research that I just finished, is a study of caregivers of people with Alzheimer's disease. And one of the things we're very interested in and concerned about is the stress and the burden on caregivers. So this is a huge issue in the healthcare system, the caregivers as well as the people. I think the new models of care will make use of all appropriate evidence-based approaches, both conventional approaches as well as what used to be called complementary and alternative medicine. Now, the more commonly used term is integrative health or integrative medicine. So what that means when we think of positive aging and purposeful aging, it means that we attend to things such as purpose, for sure, body, mind, and spirit, but we also bring in, whether it's yoga or Tai Chi or Qigong or other mind-body kinds of approaches, music, art. We look at what are all kinds of things that can help raise human well-being and human potential. My passion, though, is really not just about fixing the healthcare system and health reform. What I believe strongly we need in this country is health reform, not just healthcare reform. And the idea of health reform is a bigger idea, because health reform is what we do in our own individual lives. It's what we do in our families. It's what we do in our organizations, our neighborhoods, and our communities. And I really don't believe that we can afford to wait for the solutions to come from Washington. While I think that there will be ideas and compelling ideas that come from Washington in time, usually those come from successful community models. So I think we have an enormous opportunity here in Minnesota, as we've always been leaders in healthcare and healthcare innovation, to say, what are the new models that might break down barriers, break down silos? What are the new models that might be not only within healthcare system, but also outside healthcare system, that would truly lead us as a country towards health reform, not just healthcare reform? And I'll end by saying that I think this requires a new kind of thinking. And it really requires what I describe as whole systems thinking, whole systems leading, and ultimately to get to whole systems healing. And truly, as we sort of think about our work and our life and our responsibility on this planet, the health of people is going to be very related to the health of communities, to the health of the planet. And more, I think what we need to be drawn to is a one health idea, that there truly is one health, because all of those different aspects are connected.